Hi everyone, my name is Naomi Abrahams and I'm a patient partner with the Choice Research Lab. Today myself and my co-presenter Laurie will be talking to you about how we are putting youth at the center of knowledge translation and the collaboration approach with and by young people with juvenile idiopathic arthritis. So this is a copy of our poster, which provides some background information regarding our study, the methods, results, equity, diversity, and inclusion considerations, as well as our conclusions. So as I mentioned, our team is a part of the Choice Research Lab, and we research the management of chronic disease, patient-reported outcomes, and shared decision-making. So these are the people that work behind the Choice Research Lab. This team is mostly made up of patient partners, which you'll see in the middle, or people with lived experience of juvenile idiopathic arthritis, and it is a big part of the work that we'll be discussing with you today. So our work focuses on creating a patient decision aid called the JIA option map that helps youth and young adults with JIA make pain management decisions with their healthcare providers that are based on evidence and their values as well as preferences.
My name is Laurie Proulx, and I'm a patient partner and knowledge broker on the team. Building relationships has happened over a fairly significant period of time, and it's crucial to effective knowledge translation. I met Dr. Karine Toupin-April years ago when we were both involved in the Canadian Arthritis Network, a CIHR network of Center of Excellence funded for arthritis research. Patient engagement was central to the operations of the network. I'm also involved in CAPA, or the Canadian Arthritis Patient Alliance, a grassroots patient organization that advocates for people with arthritis. Many in our organization are also involved as patient partners in research. And Take a Pain Check is founded by a member of our team, Natasha Trahan, and it's a podcast and not-for-profit organization focused on supporting youth with rheumatic diseases. Through our work together with the Choice Research Lab, both CAPA and Take a Pain Check have worked on different projects together. For example, we have a survey out called Make Room for Youth. And I think it's just an example of how, working together and collaboration is important for successful research and integrated knowledge translation. I also act as a knowledge broker. To me, that's someone that acts as a connector between researchers and patient partners to understand goals, collaborate together, and then translate research evidence into practice. In this team, I lead patient engagement and knowledge translation activities. I facilitate and organize meetings, and I identify the supports needed to enable the participation of patient partners. I do think that my past experience as a patient partner has been helpful to identify barriers to participation and to try to create a safe environment where patient partners can speak for themselves. The patient partners have indicated, using an adapted version of the public and patient engagement evaluation tool, that what I do is helpful in providing support and reducing the power imbalances inherent in research and patient partners' relationships. Now, focusing more on knowledge translation activities or outputs, we've worked together in planning our knowledge translation and creating a plan, and we identified a number of ways to reach patients and the public. Because of this planning, we became much more active on social media, creating platforms on YouTube, Twitter, Facebook, and Instagram, as well as creating a website. We also co-developed videos, and more are coming, by the way, webinars, and wrote blog posts for different platforms like Take a Pain Check Foundation, CAPA, and the CIHR newsletter. We also co-produce academic outputs like conference presentations like this one. Here is a short demonstration of how to access our Instagram account, which is an important social media platform that was identified as more popular with youth and young adults with JIA. If you go to Instagram and type in Choice Research Lab, you'll be able to find it. Here are some examples of some knowledge translation outputs that we did together. For example, I interviewed Corinne for the Kappa community, and it's posted on our website there. Corinne wrote a blog post about patient engagement and research for Take a Pain Check, which is in the middle here. Natasha invited us as well to have a conversation on her podcast about how we work together and how patient partners are involved in making an impact. We also did a Canadian Pain Task Force submission, which is noted in the bottom left-hand corner, and we're now really established on Twitter, Instagram, Facebook, and YouTube. We invite you to reach out to the team at the email addresses noted here. You can learn more about our work by visiting our website at www.choiceresearchlab.ca. And if you click on that barcode at the top right-hand corner, you can access many of the products that I've discussed here. Thank you very much.